So here we're doing some essential PA mobs at C3 through C7. For this test, we're just going to be finding the spinous process. You're going to be looking at testing from C3, C4, C5, C6, C7. This test is generally used first as a test just to determine segmental mobility. So you're going to be palpating at each spinous process with your thumb on thumb like this, just applying a posterior to anterior pressure throughout each segment. During this, we're going to be listening to the patient to see if they have any pain or reproduction of symptoms that have occurred before to determine which segment in the spine could be related to the patient's pain. So with this, we can start if you want to have your head facing down. Best position is going to be with patient on their stomach, you at the head of the patient's head. We should apply, of course, palpating for the spinous processes. From here, just applying that posterior to anterior mobilization like so. So listen to the patient to see if there's any pain, and move down to the next one if there is none. You keep going throughout C3 through C7. Positive test would be a reproduction of those symptoms, and you can actually turn this test into a treatment by applying a grade to each pressure, to where grades 1 through 2 are used to generally treat just pain in general, relieving symptoms through increasing lubrication and the circulation of the joints, to where grades 3 through 4 are more so used for stretching maneuvers. Grades 1 and 2 apply pressures between 0 to 25 and then 25 to 75% of the full patient's mobility. And then grades 3 and 4, 3 providing 25 or 50 to 100%, grade 4 providing 75 to 100. There's also a grade 5 doing manipulations which goes past the patient's mobility and between the patient's range of motion and the anatomical range of motion, but we haven't learned that just yet. So just palpating, applying that posterior to anterior force just like so. Keeping good body mechanics for yourself.